On aged care, there is a meeting this evening, a webinar, which the Chief Medical Officer and the Minister for Aged Care will be participating in. And National Cabinet has continued to stress its concern about restrictions that are being put in place in aged care facilities, as I noted earlier this week, beyond the baseline requirements of what National Cabinet has agreed based on the expert medical advice. So, we are flagging, I am flagging very clearly at a federal level that should we not see an improvement in this area under the voluntary arrangements that we currently have in place, that the Commonwealth would be moving to require aged care facilities that wish to have an exemption to those national principles, those national arrangements, then they would need to seek authority to do that from the Commonwealth, and we would make such a decision in consultation with the relevant state and territory jurisdiction. Now, there are quite valid reasons why you would have exemptions, particularly as we've seen in northwest Tasmania at the moment, or what we've seen in Western Sydney or in other places. That is entirely sensible as to why you would have restrictions that are greater than the national baseline in those circumstances. Totally reasonable. But more broadly, having people stuck in their rooms, not being able to be visited by their loved ones and carers and other support people, that's not okay. So let's see how the industry goes with that. We would very much like to keep these things on a basis where aged care facilities are exercising their proper discretion. But we are not going to have these as secret places where people can't access them. They must. As you know, I initiated the Royal Commission into aged care, and we want to make sure that these facilities are open to their loved ones to be able to go and visit and to continue to go and engage with them, unless there is a very real and serious medical reason why that would not be necessary. So let's hope that can be worked out consultatively and cooperatively, and that is my hope and expectation. Finally, there is the nowcasting modelling, which the Chief Medical Officer will take you through. And in understanding that modelling, some important points were raised. We've moved through many phases of this virus. The first phase is what I'd call the export phase. That's when the virus was first exported, transmitted out of China into many countries around the world. And in that first phase, Australia moved very quickly to put in place the restrictions of travel into Australia, and then the excellent work done by particularly the Chinese Australia community here meant that Australia was substantively protected from that first export wave of the virus across the world. The second, where Australia was more significantly impacted, is what I'd call the repatriation phase, that repatriation of Australian residents and citizens to Australia as they return from many parts of the world where that initial export of the virus into many of those parts of the world, they became exposed to that and they brought it home to Australia. And we saw many, many internationally acquired cases, and more than 2/3 at certain times of the total number of cases in Australia. And that's why we put in place the quarantine arrangements. That's why we put the restrictions in place. We responded to that as a national cabinet, and you've seen the evidence of those measures as we've seen the curve flatten and the number of cases being additional each day reduced to the levels you're now seeing. We are now in that third phase, which we have to protect against, and that is the community phase. That's where the virus actually moves from within our own community. And that requires particularly different tools, building on the ones that we already have in place. And that is the testing, that is the tracing, and that is the rapid response. And in today's modelling, what you'll see is the difference as you've moved through those different phases. The last set of modelling you saw included all of the impact of the international cases in our data. And both the Chief Medical Officer and I had flagged on earlier occasions that we can't become complacent because of the fall in the number of internationally acquired cases, which has been the predominant drop in the number of cases we've had in Australia. We now have to be wary against community transmission, and so we are dealing with that third wave of the virus. We will also be then working towards decisions that we have to make over the next few weeks, getting the key data metrics in place as to how we'll make decisions on further easing of restrictions. We are, though, I confirm, seeing states and territories individually waiving various parts of the restrictions they have put in place above the baselines. They're making those announcements almost on a daily basis. We welcome that, whether it's in schools or in other areas, and we can expect to see that happen over the next few weeks. The National Cabinet will meet next Friday again. And before I hand over to the Chief Medical Officer, I would note, of course, that tomorrow is Anzac Day. Now, Anzac Day this year is going to be like none any of us have ever experienced. A time when our normal traditions around Anzac Day will, of course, be interrupted. But in another way, it'll be a very special time, because I will have the opportunity to reflect on Anzac Day perhaps in ways that we haven't before. The Light Up the Dawn initiative tomorrow morning at 6, which follows the national commemorative service at 5:30 from the War Memorial, which will be telecast around the country, is an opportunity for all of us to gather as our nation remembers its fallen and its heroes and reflects on the great values that sustained them at other times. It was 100 years ago when Australians returned from the First World War, and on their first Anzac Day in Australia, it was in the middle of the Spanish flu. And so something very similar to what we will face tomorrow as we gather together without the parades, but we do so quietly and commemoratively. And I do think it'll be a very special time. And we would ask also, because there isn't the opportunity for so many veterans to get together like they normally would, and it's a very special time in so many ways for them to catch up with mates, which they do often, but Anzac Day is special. Let's remember them tomorrow. Make a post, thank them for their service, let them know they're all appreciated, much admired, greatly respected, and join in the national effort, I think, for an Anzac Day, which will be one to remember for a very long time.